Welcome to rePROs Fight Back, a podcast where we explore all things reproductive health, rights, and justice. I'm your host, Jenny Wetter, and I'll be helping you stay informed around issues like birth control, abortion, sex education, and LGBTQ issues, and much, much more. Giving you the tools you need to take action and fight back. Okay, let's dive in. Hi, rePROs, and welcome to this week's episode of rePROs Fight Back. I'm your host, Jenny Wetter, and my pronouns are she, her. So, y'all, this week's episode is a little heavy. We are talking about gender-based violence. So just a bit of a trigger warning because this whole episode is going to be talking about it. So, just check in with yourself, see if you are in a place to listen to it right now. If not, come back to it later. Or if it's just something you need to avoid altogether, we'll see you next time. Don't listen if you are not in a place to listen to it. And I think I've talked about this before, but I'm not sure. I've done it in other places, but I am a survivor of gender-based violence. It's not something I talk about a lot, and I'm not going to share my whole experience, although maybe someday I will. So that was in the back of my head as I was recording this. But also what I was really thinking about was, I don't know if y'all have read any Roxane Gay. She's just an utterly amazing writer. She's just so good. I've read multiple, but two of them have really just stuck with me. So first is her book Hunger, and it was just so good. And it just really, I think about it still. And I read it a while ago, a couple years now. So that was one. But one I read more recently is an anthology she put together called Not That Bad, Dispatches from Rape Culture. And that was all I could think about while I was doing this interview is, she talks about in the intro she wrote how often survivors of violence, particularly sexual violence, but also I would say gender-based violence in general, often have a way of dealing with their trauma that is, what I went through is bad, but it wasn't that bad. And that just really stuck with me because how often I know I have said to myself, like, when I think about sharing my story is, it was bad, but it wasn't that bad. So many people have been through so much worse. And that's just a way that a lot of us deal with that trauma is by comforting ourselves, by saying it wasn't that bad. So I just want to say to the 1 in 3 of us who have suffered from gender-based violence that I see you, I hear you, I am there for you, and it's okay to admit that it was that bad. I still struggle with that, so I know it's hard. And just know that you're heard and believed. And yeah, that was just something that was playing through my head as I was doing this interview. And I know it's hard. And we're all working through it. And we're going through the process. So it felt important to me to say that and to share because I don't know. That intro she wrote to the book just really stuck with me, and particularly the part about us telling ourselves it wasn't that bad. Yeah, I don't know. I don't know if you can relate, but it was something that really stuck with me. And before we turn to this week's episode, I just wanted to say if you need help or someone to talk to, you can always reach out to RAIN, the Rape, Abuse, and Incest National Network. You can call their 1-800 number at 1-800-656-HOPE, or you can do a live chat online at online.rain.org. They're there for you if you need someone to talk to. And with that, let's turn to this week's interview. Hi, Gayatri. Thank you so much for being here today.
Thank you so much, Jenny. It's really nice to be here.
So before we get started, do you want to take a quick second and introduce yourself, including your pronouns?
Sure. My name is Gayatri Patel. I am the Director of Gender Advocacy at CARE USA. My pronouns are she, her.
Awesome. So I'm really excited to talk to you today about gender-based violence. I feel like it's something we haven't talked about on the show recently, and it's so important.
It's incredibly important, and I love talking about GBV, so thank you for having me.
So I guess maybe before we get into all of it, we should probably start with the really basic to make sure everybody is on the same page. One, we're going to say GBV a lot instead of gender-based violence. Just it's so much easier to say GBV and
Yeah,
faster. But what is GBV?
sure. Well, I mean, I think at the very basic level, GBV is harm of any sort perpetrated against a person's will on the basis of their gender or their gender characteristics. So, examples of GBV include things like rape or other forms of sexual violence, domestic or intimate partner violence, some forms of human trafficking, child marriage, but then other forms that you wouldn't necessarily expect, like psychological violence, like harassment or controlling behavior, or economic abuse, such as restricting access to financial resources. So it's really that kind of harm that's based on gender or sex or gender characteristics. And it's, most often committed against women and girls, but it's really important to know that boys, men, people of other gender identities or perceived gender identities can also be targeted based on their gender or sex. It's really kind of a universal issue.
Yeah, I think that's really important to dig out all of the aspects of it because I think most people, when they hear it, maybe only think of intimate partner violence or sexual assault, but there is a lot more that falls under gender based violence than just those very important parts.
Yeah. I mean, and part of it, and I think it's really important to understand, is that it's not something that's committed because of sex. It's something that's really committed as an act of dominance. It's a reflection of, power imbalances and the need to control. And unfortunately, it also means that when people are subjected to gender-based violence, their concerns, the harm committed against them is also often discounted because it's not considered serious, or it's so normalized that it's considered not so much of a big deal. But it really is a big deal, and it does have really deep and strong and enduring impacts on those who've survived it.
So now that we know what it is, maybe we should talk about what gender based violence looks like globally, just to kind of get an idea of the scope of what we're talking about. Because a lot of women, but I mean, not just women, but I think a lot of the data tends to be focused on women, are impacted by it.
Yeah, absolutely. I think there's a common misunderstanding that GBV, or specific things like child marriage or human trafficking, are things that happen somewhere else, not in the United States, or not to rich people, or not to people of a particular religion. It's really something that's incredibly universal. It happens regardless of what country you're in, what social or economic class you're in, what religion you follow. It's what your economic status is, etc. It's something that's so pervasive that 1 in 3 women have reported experiencing some form of gender-based violence. And this is actually likely underreported due to some of the stigma they face, or the lack of access to reporting mechanisms. And so it's, 1 in 3 women is quite alarming. But what it means, in practice, one girl every 2 seconds will be married before the age of 18, or 137 women are killed by a family member every day, or 1 in 10 women in the European Union report experiencing cyber harassment. It's incredibly, I don't want to say common, because I don't want to normalize it. This
Yeah.
is not something that we should kind of feel is commonplace, but it's something that is a very common lived experience of people all around the world, and it's something that we have to address as a common issue, not something that is happens over there and we don't need to worry about it.
Yeah, I think that's so true. Like you said, 1 in 3 women have experienced it, and that's globally. And it's just so devastating to think that it is so. You're right, common's not the right word to use, but so every day. Like, for sure, multiple people probably have experienced
Hmm.
this. And something that is not talked about a ton. There is still a little bit of that stigma around it, which is just this like
Right.
extra weight that people have to carry.
Absolutely. I mean, the impacts I think are so under internalized. People don't really get just how deeply gender-based violence can impact someone. It's of course, physical harm. You can have bruises, you can, feel physical injuries from the violence. There's psychosocial harms, feelings of depression, feelings of post-traumatic stress syndrome. There are feelings of isolation. You can have a hard time getting through the day or completing, basic tasks or taking care of your family. And so the impacts are, very internal and very centric on the person who's experienced the violence. But it also has ripple effects out if that person can't function during the day. And I think we as advocates and the policymakers that we advocate towards really need to understand that, really need to understand that, this is not something that we can treat on the surface. It's something that requires changing the root causes of it, and then also providing real, sustainable, and comprehensive support to survivors.
Yeah, because it has real lasting impacts, right? On economic participation, on
Hmm.
empowerment. If a girl is married young, that has real lasting impacts on her life, maybe even her health. If, she gets pregnant early, she has a higher risk of experiencing maternal mortality. I mean, these have
Exactly.
real impacts.
Yeah, I mean, the correlation between child marriage, intimate partner violence, and contraction of a sexually transmitted infection is like a straight line. I don't actually have the statistic available. I'm sorry about that, but it's such a co-functioning process that we really need to look at all stages of it and really see it as a continuum of, we have to address child marriage, we have to address the effects of it, and we have to address the secondary impacts on the people around them.
Well, it goes back to what you were talking about with power, right? Like, if a girl is married young, she is already at a huge disadvantage for power in that relationship
Hmm.
or a person. And then that, can snowball into all these other areas, right? Where you see intimate partner violence is a power dynamic. And if that person is already having so much less power coming in, like, it just kind of snowballs on itself.
Exactly. And it doesn't have to be like, a physically violent thing. It could
Right.
be as simple as restricting the child bride from leaving the home, or controlling their access to technology, controlling their access to family resources and funds. There's so many different ways that children in child marriages can be abused.
Yeah. So I know you spend a lot of your time working on both child marriage and GBV, and often there's a lot of overlap, but there is also a lot of siloing, right? There's like
Hmm.
GBV conversations and then child marriage conversations, and it's nice to see some of that starting to come down as people start talking about GBV in this broader sense and like understanding the dynamics of it, because that is just something you see especially in a lot of things, but especially in foreign assistance, as
Yeah.
the siloing of issues.
Yeah, absolutely. I think part of that is a tendency to focus on adults, and kind of this newer effort to bring more attention to the needs and rights of adolescent girls is so critically important. It's such a critically important time in a female's life. It's adolescence is around the time that they might be taken out of school or married or sent to work, and yet they're not seen as adults in their communities or in society. Yet they're not given the support that a child would normally get. And so there's a lot going on there. And so addressing child marriage, addressing adolescent sexual and reproductive health and rights, addressing access to education, dealing with the particular consequences and impacts of, something like a humanitarian emergency on an adolescent girl is really important. They do need specialized attention as a, like, a population of concern, but it does need to be seen in this broader light of, it's based on their gender, and women will likely face some form of violence or abuse or exploitation at various stages of their lives. And it's because of gender inequality at the very root of it, and the social norms that kind of manifest this gender inequality. So for advocates like us, for practitioners, for people who work in these communities, working to kind of upend those social norms or disrupt those inequalities or those stereotypes is just, it's incredibly important, because I don't think we'll get to kind of sustainable lasting change until we address those issues.
Oh, for sure. I mean, if you're not getting to the root causes, then it's just kind of a band aid, or
Right.
not even, right? You're just addressing the harm after it happens in a lot of cases, then.
Exactly. And you're not looking at how it's, the longer term impacts. So yeah, we do need to we need to do better in terms of our laws and our policies, and how we interact with survivors and support survivors. We need to make sure that we're focusing on the long term while we're addressing the immediate and short term injuries.
So, you mentioned humanitarian settings, and that is a special case, right? Because we often see a big uptick in instances of gender based violence in a
Absolutely.
humanitarian situation.
Unfortunately, yes. I mean, gender based violence of all forms tends to go up in a humanitarian crisis. Domestic violence or intimate partner violence is the most prevalent form of gender based violence in a humanitarian emergency. But you also see a rise in child marriage, largely because girls are taken out of school when they're displaced, or parents are seeing it as kind of a protective mechanism. They can protect their daughter by marrying her to a safer, more stable family. You see human trafficking rise because it becomes a crime of opportunity. But the domestic violence or intimate partner violence is kind of an interesting and really tragic case, because what you're seeing is kind of an exacerbation of previously happening trends. But in the middle of a crisis, there's chaos, there's displacement, there's a breaking apart of family structures and traditional social support structures, and people are stressed out and they take it out by using violence. And so some of the work that my organization CARE has done has seen that in some contexts, as many as 70% of a population in a humanitarian crisis has experienced domestic violence or some other form of gender based violence. And that's astounding if you think about it. I mean, 70% of a particular group of people having experienced gender based violence, it's a crisis in and of itself. And I think COVID, for instance, is really kind of highlighting that.
So, that is shocking. And I feel like I might have known that, but am shocked all over again because, like, I didn't. Like, 70% is just a mind bogglingly large number.
Yes, it is. And unfortunately, I mean, I think we're getting better at identifying it and kind of closing some of the risk factors that make it such a thing. But I mean, that's the nature of domestic or intimate partner violence. It happens behind closed doors. It's not easy to see. And it's so normalized that even if you do see it out in public, does it affect you the same way as it should, enough to make you want to do something about it? And so I think what we've been trying to do through legislation, through bringing more attention to these kinds of situations where GBV is going up in emergencies, is to really focus attention on how we can close those gaps, how we can make sure that humanitarian responders are equipped and have the expertise to look for what those risk factors are, to prevent violence before it's happening, to respond swiftly to trends of GBV, to support survivors. And in humanitarian crises, that's not a given. You have an emphasis on providing the very immediate life saving needs. Addressing the psychosocial impacts of domestic violence or sexual assault in a humanitarian emergency may not bubble up to be one of the top priorities, yet it's so incredibly important to people's lives. And so we really do need to bring more attention to it and bring more leadership and funding and resources to it.
So I think it's really important to turn to one of the other things you mentioned, and that is what is happening during COVID. And what are we seeing? What's happening?
We're seeing, unfortunately, exactly what we thought we would, which is a dramatic increase in gender based violence, primarily domestic and intimate partner violence and child marriage and FGM, female genital mutilation. And it's largely because the conditions are all there. There was that pre-existing gender inequality that made, things like domestic violence a thing. But then you throw in that people's movements are restricted due to stay at home measures. And so they're literally trapped in a home with their abusers. You see people losing their jobs or their livelihoods or their economic independence. So they become dependent on their abusers and continue in those relationships. You see girls being taken out of school, or schools are closed, so girls and children are out of school, so they're more available to be abused. And interestingly, schools were a source of information for children, and a source of kind of support, being able to report abuse that they would be experiencing at home or in the public. They would have the ability, or at least many of them would have the ability to report that through their teachers or through school mechanisms. That avenue is closed to them, and so they're not getting the support that they need. So it's the conditions are kind of ripe for that, and we're seeing a dramatic rise in gender-based violence around the world as a result of the pandemic.
Yeah, and I think that's really important to again emphasize that again, it's not just in developing countries that we're seeing this, it's around the world, it's everywhere that we are
Yeah.
seeing this increase in gender based violence.
Yeah. I mean, I think that some of the earliest reports we were seeing were coming out of countries like France, where calls to their domestic violence hotlines had skyrocketed in the first couple of months of the pandemic. Countries like the United States, where same thing. So we really do have to look at it as this is a universal issue, and we kind of have to address it for what it is, not just address it as like a cultural thing that happens somewhere else.
I have to say, the one thing that is nice about this is that we are seeing the alarms being erased like almost immediately. Like, as soon as this was happening, we started seeing groups being like, hey, we need to watch out for this. It is already happening. And
Hmm.
seeing those conversations happening much sooner than they have in previous crises.
Yeah, I mean, I noticed that too. My organization, CARE, we do rapid gender analyses. This is a tool that we use for all of the humanitarian situations that we work in. But with COVID, we did it almost immediately. And since then, we've produced maybe 60 rapid gender analyses looking at the different ways that this particular crisis is impacting different genders differently. So men, women, boys, girls, other genders, to kind of surface what are the key risk factors, what are the things that women are experiencing and girls experiencing. And GBV was almost immediately one of the things that we were able to detect, and we really put a lot of emphasis around bringing attention to that. It's not necessarily something that anyone was really thinking about outside of the GBV community or outside of the gender equality community. And I'm really grateful that people with big platforms like the UN Secretary General himself were able to also raise the alarm and get people thinking about this. But unfortunately, the reality is that we could be thinking about it, we could know that it's happening, but are we able to address it? I think that's where we're falling short.
Yeah, unfortunately, I feel like that's a too common theme
Yeah.
with a lot of things, right?
Yeah. Especially in this context, because I mean, there's so much emphasis, necessary emphasis, on stopping the spread of the disease. But what does that mean for everything else around? Like, the traditional reporting mechanisms or referral mechanisms for GBV were shutting down. People weren't allowed outside of their homes, so they weren't allowed to access the support they needed. Necessary medical services were being diverted, or more heavily focused on the pandemic and the medical crisis there, not necessarily looking at the GBV crisis. And one incredibly important thing, which I think we often overlook, is that women were not, by and large, part of the decision making around COVID responses at local, national, regional levels. We CARE did a study where I think something like 75% of the government kind of decision making bodies had no women or had a very small percentage of women. And so of course the responses are not necessarily going to meet the needs of women and girls who things like GBV that disproportionately impacts them. And we need to look not just at what we're doing in response, but how we're making decisions about the responses. And that's a place where women and girls and those who are really strongly impacted by the crisis need to have their voices heard.
Yeah, it's hard to focus on an issue and what needs to be done on the ground if they're not even part of the conversation.
Exactly.
So, we've talked a lot about the issue, but maybe we should take a second and talk about what do the survivors need?
Yeah, that's a really important question. There's so many things, and each survivor is different, each set of needs is different. But I think by and large, making available support services like medical care, psychosocial care, particularly sexual and reproductive health and rights services. So things like post-exposure prophylaxis or a whole host of medical and psychosocial interventions there that get at some of the SRHR aspects of gender-based violence, particularly for survivors of sexual violence, and adolescent girls are high, you know, very much up there. But I think at its heart, we need to ask the survivor herself or himself that, what is it that they need? What is it that they want? A lot of the times it's as simple as they need a job or they need, some way to get away from their abuser, yet they're economically dependent on them. They need legal services. So I think, having that emphasis on things like reproductive health or access to job opportunities, access to legal services, immediate crisis counseling, long term psychosocial services are all incredibly important and part of this kind of package of comprehensive responses to GBV.
Yeah, I really like how you frame that because I think so often it gets political so fast when we talk about needing reproductive health services, but focusing on what the survivors want and what the survivors need, I think is so important.
Absolutely.
And and that should be the bottom line.
Absolutely. I mean, the one thing that I learned is when I was doing crisis counseling is that A, it's never the survivor's fault, and B, you just have to validate their feelings and validate how they've experienced the abuse that they've endured. It's about them and what they need, and I think we really need to centralize that.
So, let's turn to the new administration. So, President Biden has a real history of being passionate and caring about issues around gender-based violence. What do you hope to see from this new administration? What are some things that you would love to see them do?
It's really a breath of fresh air to be able to talk about actual policy options for gender-based violence. And because President Biden has been such a champion on these issues, I really see it as an opening, as an opportunity for us to do something positive and to push the envelope. What we saw, was it a week ago, 2 weeks ago, with the executive order establishing the White House Council or the White House Gender Policy Council, was a particular emphasis on gender based violence. The idea that there needs to be a national action plan on GBV, that there needs to be an update of the previous US strategy to prevent and respond to GBV globally, the fact that there will be a senior level position on the council that is focused on GBV. I think those are really positive signs and really big opportunities for this administration to advance this work. So, really looking forward to working with the administration on that to shape how they carry out this work and really hope that, civil society is a large part of it, which the EO also gave a nod to, that women who are survivors or people who are survivors are part of that process and really included in some of the thinking and decision making around that. But really, we need funding. I mean, that's a universal thing, right? We need the programs, we need the resources to be able to address this. So, the coalition that I co-chair, along with partners from Amnesty International and Promundo and Futures Without Violence, and a whole host of organizations, I think it's 180 civil society organizations together, are really putting emphasis on the need for the right structures, like what the White House Gender Policy Council executive order started to lay out, but also the need for resources and for having, if nothing else, at least just a standalone fund where we can, program around GBV around the world. And it's not this process of like getting crumbs from this program and double counting things. And we need a concerted effort.
Yeah, it is really a breath of fresh air to be able to think so positively and like kind of dream big for what we would like to see that we just haven't been able to do for a while.
Exactly. I mean, if I can be political for a moment, this issue was really politicized in the previous administration in a way that was harmful to the issue. And I think having this administration kind of pivot in the complete opposite direction is really gratifying. Maybe that's not the best word. It's an opportunity, and we want to take that opportunity with two hands.
So we always like to wrap up because our issues are often fairly heavy, with focusing on what can the audience do? What actions can our audience take if they care about GBV? What can they do to help?
They can call their member of Congress. There's a number of bills, legislation floating around to address gender-based violence. In fact, I think this week the Violence Against Women Act, or Violence Against Women Reauthorization Act, is being discussed in Congress, and that deals with domestic violence against women issues. There's a counterpart, a global counterpart called the International Violence Against Women Act. There's also a bill that my organization has prioritized called the Keeping Women and Girls Safe from the Start Act in the Senate, and in the House it's called the Safe from the Start Act. So call your members of Congress, tell them this is a priority for you and you want them to act, use their platform, speak up about these issues. It does not need to be political. It's a bipartisan issue. Addressing violence against people is not something that needs to be one party or the other. Also request that they resource it. This is around the time that Congress is thinking about how to appropriate money. And we want strong funding for GBV programs around the world. And we know that the president is thinking about it and his administration. We know Congress is thinking about it. So when you're calling your members of Congress, signal that you think that this should be a priority. But other than that, in your day-to-day life, you can volunteer. I used to volunteer with an organization called RAIN, which is the Rape, Abuse, Incest National Network. And they run hotlines and online hotlines for crisis support. You don't have to be an expert. You can just be someone who cares and is willing to do the training it takes to be a volunteer. But it's a really positive way to volunteer your time for something that you feel strongly about. But there are other organizations that do support services for survivors, work with at-risk youth. So volunteering or donating is also always welcome.
Well, Gayatri, I had so much fun talking to you today about a very heavy issue. So thank you so much for being here.
Thank you so much for having this discussion. It's so great to be able to talk about GBV more, and really want to encourage your supporters to care about this issue. There's so much to do and so much to say, but really appreciate you for having me on and for having this discussion.
Oh, it was so much fun. Thank you.
Thank you.
Okay, everybody. I hope you enjoyed my conversation with Gayatri. I thought it was really good. As always, I learn a lot. Some of the numbers she talks about of people suffering gender-based violence, it's always shocking when you hear that. And it should never not be shocking. But someday, hopefully, those numbers will come down. And with that, just know you can always reach out to us. You can email me at Jennie, JENNIE, at rePROsFightBack.com. Or you can reach out to us on social media at rePROs Fight Back on Facebook and Twitter, or rePROs FB on Instagram. And with that, I will see y'all in 2 weeks. For more information, including show notes from this episode and previous episodes, please visit us at our website at rePROsFightBack.com. You can also find us on Facebook and Twitter at rePROs Fight Back and on Instagram at rePROs FB. If you like our show, please help others find it by sharing it with your friends, and please rate and review us on Apple Podcasts. Thanks for listening.